I'd always wanted to be a police officer ever since I was a little kid. And I was taking a sociology class in college that required us to do some kind of 1 week shadowing of a social service profession. And one of the options was to ride along with the police department. And so I did that for a week and was absolutely hooked.
In July of 1984, I started the academy for the Denver Police Department. I started the job because I wanted to help people. It was a continuation out of the military, from the military police into civilian policing.
Worked in narcotics as an undercover officer, and so certainly was responsible for enforcing those drug laws and things like that. So we received education on heroin and all the other different kinds of street substances because that was what we were going to be facing on the street. That was really my first interaction with the different kinds of opioids, but it was more from an enforcement type of thing. It was the street stuff. And I don't think I ever really had an appreciation for its impact.
I learned about that in 1999 when I injured my back in a violent resistance. When I was released from the hospital, they kept me on opioids for management of pain control. And during that time, I became more and more dependent on the opioids. It relaxed my mind. It kind of put the fires out that were burning in there from the PTSD. Although they did treat the pain, it was obvious that I was using them for the PTSD.
I was prescribed opioids after a miscarriage 6 years ago, and they were prescribing them, quote unquote, for pain. I didn't have that level of physical pain, but they never talked to me about the risk for emotional dependency on those medications. My husband has also struggled with dependency on opioids. He was injured, his quad muscle detached from his kneecap, and it was massive surgery.
The pain that I went through was absolutely excruciating. I've never experienced anything like that in my life. So what did I do? I started taking the pain meds. And honestly, it never even occurred to me that my body could develop a dependency to it.
It was affecting my family life. It was affecting my job. Being on the other side of the fence now, I fully understand how easy it is to get hooked.
I think around the 9th or 10th day, I didn't have a lot of pain in my leg. And I thought, you know what, I don't want to take that pill. I'm not going to take it. I started breaking out in a cold sweat. I started panicking. I started shaking. I wanted to rip my brace off my leg. And my wife literally had to, hold me back and hold me down. I remember her saying, I'll get you another pill. And for whatever reason, there was a glimmer of clarity that I thought, if I take the pill, I'm not taking it for the pain. I'm taking it to control the anxiety. And that was when it hit me at that moment that my body, just in that 10 days, had developed a dependence, and it scared the crap out of me.
There's probably as many different stories as there are different opioid addicts, but there are certain ones that are really common. Someone's injured, most of the time it's a car accident, something like that. They'll say, I hurt my back in a car accident. The doctor was prescribing me whatever opioid painkiller, and at some point the doctor decided I didn't need it anymore. And as soon as he took those away, I found myself looking to buy them illegally, and then pretty soon I found that heroin was cheaper, and I started buying my heroin on the street. I started out smoking it, and eventually I found that injecting it was cheaper, and that's how I got to where I am today. A lot of people who say, something terrible happened to me when I was younger. I was abused by a parent, or I was sexually abused by someone in a position of trust, and I dealt with that pain all my life, and I didn't realize exactly how much pain I was in until when I was 16 years old or something. I smoked heroin for the first time, or I took a Vicodin for the first time, and all that pain and all that stress that I've been shouldering just disappeared. Oftentimes it's just I hadn't had a lot of negative experience with drugs or alcohol, so I continued to use them. At some point, I moved on to cocaine, or I moved on to methamphetamine, or I moved on to heroin. The individual doesn't realize that they're being sucked under, right? They don't feel that undertow. And very quickly, it happens, that one day comes along where the individual says, okay, today I'm not gonna do that thing. I'm not gonna try I'm not gonna take the opioid, or I'm not gonna use methamphetamine, or I'm not gonna have a drink today. And they find they can't do it. So it sneaks up on people without them really understanding that it's coming.
I understood that people struggled with it, but I guess I always kind of thought it was like, be strong. Don't give in to that.
We're actually, all of us, capable of experiencing addiction. We're all capable of becoming addicted to opioids because of the physiological piece of it and the psychological impact.
The sickness and the withdrawals and the depression that come along with trying not to use opioids are profound. They're really profound. And so the individual who says, oh, well, come on, have a little willpower or something, they have just no comprehension of how powerful a force they are.
When I was young, my parents, my community, my family taught me what an addict was, right? I knew an addict was someone who was screwing up their life, making decisions that were oftentimes poor, throwing their future away. So I was taught at a young age that an addict was something that was bad. There was something wrong with them, and not wrong with them physically or biologically, but they were just wrong as a person. And I think that as I've come to understand what addiction actually is, that it's a disease, it's been transformative for how you actually view it and how you treat it.
And I hear people push back and say, I don't believe it's a disease. But then my response is, it doesn't really matter if it's a disease. In a lot of ways, it's worse than a disease, because it'll kill you just like a disease will, but it also causes you to become ostracized from family and friends and community. And it's a really ugly, slow death. And while we understand that addiction is chronic and relapsing, a lot of times they don't. So they just think, God, I'm a terrible person. I suck. I can't believe I can't do this, or I can't believe I don't have this under control, or I can't believe this is the mess I've made in my life. And that's why one of the reasons I love treatment is because that's when they see like, oh, I see, like no one can handle this.
With all of the presenting problems that come into my office, so much of it is attached to shame. I've been working with responders for the past 10 plus years, and I've seen multiple people struggle with this. And what's interesting is it was always stigma that kept them from seeking support. So shame is one of the first pieces that we really have to work on in the therapy room.
Therapy for addiction issues understands that this is going to be a year or 2 or 3 that the individual is going to have to go through this and be going to classes and coming to individual sessions, probably using some form of medication-assisted treatment, and that it's possibly after a year or 2 or 3, you might be able to look back and say, okay, we have successfully treated this person's problem. These people are hurting, and they're scared, and they're embarrassed, and the worst thing, the best thing, let me go that direction, the best thing you can do as a medical professional or a legal professional or somebody who's respected in the community is treat the person with respect and kindness and dignity. And if you don't take that opportunity, and worse, if you shame them further, you lose them. You lose them right there.
So many opioid use disorders come from a background of trauma and a background of despair. And at first, when they start using, it actually takes away that despair. It takes away that anxiety. But then as they continue to use, they find that they dig themselves a hole that's so much deeper than that original insult. And it's almost like compounding misery when they have a use disorder. And I think that the first cracks in that got people to start thinking about recovery is actually to show them that they're worth it. That you see in them the possibility of a better life, and that they are 100% deserving of something better than their current state. Once you start giving them that narrative of hope, that narrative that they're worthy of recovery, that narrative that they can have a different life, that doesn't always mean that you flip the switch, but it's at least a crack of sunlight sometimes into that dark room. And the more people who give them that narrative and give them that opportunity and show them that there's a way out, the more likely that person is going to get into recovery. We have to give them hope, because hope is one of the most transformative ways that people emerge from addictions.